September 21st, 2013 was a typical Saturday morning for me. I woke up, I prepared breakfast for my two daughters I normally do every weekend. I was on the phone talking to one of my friends when suddenly I couldn't breathe. I found myself struggling to breathe, to gasp for air, and I eventually got off the phone and I got myself ready to dress so I could get to the hospital. What normally takes a few minutes to do, it seemed like it took me forever just because I couldn't breathe. I finally got dressed, I made it to my car, and I drove myself to the hospital. Looking back now, I know that was not a very smart decision because at that time I didn't know what was happening to me, but thank God that I made it there safely.
I met Ranetti Woods for the first time at the hospital as a 37-year-old young lady who presented with shortness of breath and swelling in her legs. And my first impression was she cannot possibly have anything wrong with her that would be too serious. But I was surprised and shocked to find out that her heart function was less than 10% of what it needed to be when she came to the hospital. And anyone who has heart function that low, their chances of survival at 6 months are less than 50%.
I was admitted to the back, and then I was told I need to stay overnight. At that point, I got disgusted when she told me I had to stay, because I knew at that point it must have been something more. And I ended up staying that night. My daughters came up to visit. My sister brought my daughters, and they sat with me for a while. And my baby girl, I could tell that she was really upset. I was sitting there trying to just still be strong. I didn't want them to see me cry, though I was really distraught on the inside. But I just didn't want my girls to see me cry, to scare them even more than what they already were. But they sat with me. Looking at them, I knew whatever was about to happen, that I had to be strong and I had to get through it. I had to overcome it.
Ranetti, being as young as she was and being a woman, and to my concern and her concern that she may have significant cardiovascular disease was not on the forefront. And as young as she is, she was not thinking that she may have such a life-threatening condition. In recent times, we have found out that heart disease is just as common in women as it is in men, and it is #1 killer in women just like it is in men.
I had a bigger sister, older sister, Jennifer, that passed away in 1994 from congestive heart failure at the age of 38. And here it is, September 21st. I just made 37 on September 5th. And all I was thinking in my head is that I'm going to die. To me, it's like I'm not going to make it past the age of 38. My sister didn't make it. Maybe I couldn't make it either. And I thought about all the heart problems in my family. I had my mom, how she had open heart surgeries. And so at that time, it hit me. Dr. Shah, he has actually been a wonderful doctor through this whole process. And he told me what was going on and everything. He gave me hope. He told me I had no blockages. He told me I didn't need any stents and that my heart was just weak. He told me that it could get better with diet, exercise, and the right medication.
So over the last 3 months, Ranetti has been very, very good about her medical therapy, and she has worn the life vest like her life depended on it, and it did, and has improved significantly.
Over the next few months, I changed my eating habits. I started going to cardiac rehab. 3 times a week, I checked in with a heart failure clinic at the Lift Center.
And thanks to American Heart Association and the guidelines they've provided for this crucial therapy for heart failure patients, she has done astonishingly well.
Today, I'm still a work in progress. There's times that I did not want to go to cardiac rehab. There was times I fell off my diet, but with the support from my daughters, my sister, my church family, and the cardiac rehab staff, I have been able to continue doing what's needed for my health.
A little bit about American Heart Association is that they are not only an American organization, but an international organization. I grew up and was born and raised in Pakistan, and going through the medical school there, one of the biggest sources of pride and honor was to be affiliated with the American Heart Association. And if you had something based off of the organization's guidelines and recommendations, it was considered to be the absolute truth. I'm proud that American Heart Association creates these programs where they work at the grassroots level and work with local hospitals, and the representatives work with the local community and the hospital to create such programs as in today's, where they're able to raise the well-needed money and funding that is essential for the research and development of care that is life-saving, as in the case of Ranetti, where she received a temporary life vest, and it is through those grassroots funding and research that American Heart not only supports but provides for that saves lives. This team makes the care that Ranetti received possible.
Go Red!
Today I know that the American Heart Association was there with me every step of the way. From the moment I walked into the ER, to all the tests that was ran on me, to the equipment that was used to diagnose me. They was there through the research for the medications that I use, through the guidelines the dietitian used to help me modify my diet. Your investment is truly priceless to me and my family. I'd like to thank you from the bottom of my healing heart for my today and tomorrow.